everyone. Today I'm going to be talking about behavioral analysis and how it affects our day-to-day life, how it's been developed, how we have created the frameworks that we build on today still, and how it can be applied to the mental health field. My name is Sophia Sestera, and I'm excited to present this to you. Behavioral analysis has been studied for many years by countless theorists, each adding their own thoughts and theories to the subject matter and building upon others' work. Largely speaking, behaviorists would define behaviorism as the study of observable behavior by an individual. Those who study behaviorism do not consider the internal mental processes that occur for an individual to display a behavior, but solely the physical behavior itself. Over many years that behaviorism has been studied, many theorists have used subjects such as humans, dogs, rats, among others, to further understand behavior analysis. Some significant contributors to behaviorism include B.F. Skinner, Albert Bandura, Ivan Pavlov, and others. B.F. Skinner created Skinner's box in which he placed rats to determine ways in which he could influence their behaviors in relation to food. To study his theory of operant conditioning, Skinner developed his now infamous Skinner's box. Within the box were rats who were faced with positive and negative reinforcement as well as punishments. Each the result of the rat's voluntary actions, meaning he would only provide these reinforcements and punishments in relation to specific behaviors done by the rats. Through his study of rats in this box, Skinner was able to determine how individuals can be conditioned to behave in a specific way as a result of the positive and negative reinforcements. Albert Bandura developed social learning theory. He held the belief that to learn new behaviors, an individual would first have to observe the behavior being done by another person, who is the model. In this model of behaviorism, a series of steps are done in order for a behavior to be learned. In order, those steps are attention, retention, reproduction, and motivation, meaning the person would have to pay attention to someone else completing a behavior, retain that information of how that behavior was done, why it was done. They would then reproduce the behavior, and then they would have to have a motivation to continue reproducing that behavior. Ivan Pavlov created classical conditioning while conducting an unrelated experiment regarding the salivation of dogs in the presence of food. Pavlov discovered the classical conditioning that he is now well known for. He found that when an unconditioned stimulus is presented, an unconditioned response occurs. Over time, an unrelated stimulus would be able to become a conditioned stimulus, creating a conditioned response. This is shown in the image to the right, showing the unconditioned stimulus as the food. The dog salivating is the unconditioned response. A neutral stimulus would be a bell, being that it is completely unrelated to the dog eating. When that bell becomes paired with the food in a consistent way, the dog begins to correlate the bell with the food, meaning it becomes the conditioned stimulus where the dog will begin salivating at the sound of the bell. Edward Thorndike created the law of effect. Thorndike theorized that behaviors could be strengthened or weakened according to how often the individual either receives a positive or a negative outcome as a result of their behaviors. Essentially, behaviors that create positive outcomes for the individual will strengthen the behavior, while behaviors that elicit a negative outcome will be weakened. Kind of how we're taught as children, what behaviors are allowed and which ones are not when we're punished for doing something such as pouring water on the floor. We likely won't do that again because we didn't like the outcome of the situation. In the field of behavior analysis, there are many theories and variations to the ways in which theorists believe that behaviors are formed. For many years, psychologists, scientists, and researchers have studied the different ways in which behaviors are adopted and why they are adopted. Many frameworks have been developed that outline the ways in which behaviors are developed and changed. Many of these theories rely on the use of positive and negative reinforcements or punishments, as we spoke about previously. There are three forms of behaviorism that are studied. Methodological behaviorism. It rejects the study of internal mental processes and only addresses physical and observable behaviors, nothing else. Psychological behaviorism, like methodological behaviorism, stresses the importance of observable behavior while placing a focus as well, though, on an external stimuli from the environment. Lastly, analytical and logical behaviorism places emphasis also on the observable behaviors, though it also considers the mental state that causes the individual to behave in the specific way. Behaviorism plays a large role in the mental health community as many therapeutic strategies derive from the study of the behaviors. Professionals in the mental health field apply behaviorism to their treatment methods for various mental health conditions, allowing a patient a health method that provides them with the skills to change their own behaviors in a positive way and that better suits them and their lives. Many treatment methods have been created with a behaviorism point of view, including but not limited to CBT, or cognitive behavioral therapy, exposure therapy, applied behavioral analysis therapy, and contingency management. Cognitive behavioral therapy is used with patients whose mental health conditions are based mostly in unhealthy ways of thinking. It attempts to teach the patient to change their patterns of thinking to more positive thoughts. It is most helpful under the following conditions. Either the addressed issues are the result of unhealthy ways of thinking, or the issues are the result of unhealthy learned behaviors. CBT would provide the patients with the skills necessary to change those thought patterns and behaviors. Patients would learn to recognize their own unhealthy behaviors and thoughts and learn to exercises to eliminate those thoughts and behaviors in a healthy way without the guidance of the therapist any longer. Many different mental health disorders can be treated with CBT, such as anxiety, depression, ADHD, bulimia nervosa, and hypochondriasis. Exposure therapy was designed to help individuals who suffer from extreme fears of things. Through therapy, they are slowly introduced to the item and progressively are more exposed to it until their fears are lessened. Most commonly used to treat conditions such as phobias, PTSD, social anxiety, OCD, and generalized anxiety. Fears that are treated may include those that are of items, places, animals, situations, feelings, actions, among many more, making a need for many variations of exposure therapy, including in vivo exposure, which is real-life close contact exposure, as seen in the picture, where someone is presented in person, close contact with a spider in which they're afraid of. Imaginal exposure, the individual is asked to imagine the subject they fear, so instead of being presented with a real spider, the woman would then be asked to think of the spider. VR exposure. VR is usually used when it is not possible or practical to utilize in vivo exposure, such as being on a boat. For this example, I'm just going to explain the spider. It would be as if the spider would be real in the same vicinity as the woman, although it would be in the virtual reality headset. So she would not be actually encountering the spider in which she's afraid of, though it would feel real. Interoceptive exposure induces the physical feelings that are similar to those of fear, but there is no, we'll say, spider around them at the time. They would only feel the physical sensations of fear without the actual fear-inducing thing. Contingency management utilizes a reward system to promote a positive change in unwanted behavior. Most often, this form of behavioral therapy is used in substance abuse treatments to encourage the patient to no longer abuse substances that they are struggling with. While substance abuse is the most common reason for the use of contingency management, other reasons may include medication compliance. It encourages the patient to take their medication as they are supposed to. And obesity, patients are rewarded as they lose weight, thus bettering their health as well. This would also work for encouraging patients to work out more. They could benefit from the reward system as well. as they engage in exercise, as well promoting a healthier lifestyle for them. Behaviorism has grown greatly in the mental health field for good reason. It provides opportunity to patients to take charge in their own mental health journey, providing the mental health professional with a method which allows them to accurately measure progress made. When formulating a treatment plan for a patient, behavioral analysis allows the provider to develop one that is tailored specifically to the patient's needs in such a way that they would see positive results sooner than later. Underlying causes of mental health issues or conditions can easily be identified and targeted through this. Periodically, assessments can be done to determine how well the treatment is working and allows the provider to determine where any changes are needed in the treatment plan to ensure better results. By employing a behaviorist approach to mental health treatment, patients can play an active role in their treatment and continue to help themselves for time to come. Patients can continue to help themselves and make long-term changes in their behaviors to continue benefiting in their mental health, regardless whether they are still seeking treatment or not. Methods of behavioral change can be used for many mental health disorders that often are comorbid to one another, thus allowing the patient to undergo treatment for any mental health disorder simultaneously. To apply a skeptical inquiry to this, we would ask questions such as, is empirical evidence consistent among studies? And it is. There are countless studies that have been conducted that provide ample empirical evidence that shows consistency across studies. Studies have been published by theorists such as B.F. Skinner and Joseph Wolt that have been replicated and confirmed by other researchers. Studies have shown that anxiety is lessened when applying Wolt's systematic desensitization. Through studies with animals and humans, B.F. Skinner's operant conditioning has been replicated and applied in therapeutic conditions and has provided positive results. Are the interventions respectful of individual rights and values? Are there potential risks or harms associated with certain behavioral interventions? In behavioristic interventions under mental health treatment plans, patients typically are able to play an active role in their treatments and can make decisions regarding their own treatment. The health provider can provide them with information regarding the process of behavioral interventions, allowing them to make informed decisions about their treatment. Potential risks of behavioral intervention can occur due to possible emotional distress during treatments or if the patient's cultural background is not considered. Behavior analysis is an approach to studying behaviors in which only the behaviors that are observable rather than the mental processes one has in the process of performing behavior. Behaviors are able to be altered, eliminated, created, or completely changed through conditioning methods developed by theorists such as B.F. Skinner and even Pavlov. Behavior analysis allows therapists to target troublesome thoughts and behaviors and formulate a unique plan that will help patients eliminate those thoughts and behaviors. Patients are able to learn to identify their own unwanted behaviors and thoughts and apply theoretical constructs of behaviorism and conditioning to change them with or without the assistance of a mental health professional. Applying behaviorism in the mental health field provides the providers with a better understanding of the patient's behaviors and how they may have developed previously, allowing them to better target the source of the unwanted behaviors. Not only can the provider analyze the ways in which the behavior is developed, but also how environmental factors may have influenced the prominence of these behaviors.